Good afternoon, everyone. I'm Christine Ortiz-Gamino with the National Environmental Health Association. Thank you for joining us today for the Healthy Heart, Air Pollution, and Cardiovascular Health webinar. A little background on this webinar series. NEHA and the EPA have joined together to start a collaboration that promotes each other's work, along with producing a webinar series beginning with our topic we will be discussing today and possible future projects that aims to educate environmental health professionals on present issues. Today's webinar will be on air pollution and climate change, which affects at-risk populations such as older adults, particularly those of low socioeconomic status with established heart and lung disease. The webinar will provide a brief synopsis of our current understanding of air pollution, adverse health effects, describe the need for large randomized control intervention studies to reduce exposure, and will highlight the ongoing efforts to translate, communicate, and use research on the impacts of air pollution to educate healthcare providers and public health officials about what they can do to reduce exposures and improve health and well-being among at-risk populations. A bit of housekeeping first. All webinar participants will be in listen-only mode. This webinar is being recorded and will be provided to all participants within 1 week of the webinar. Also, there will be a Q&A at the end of the presentation, so we will hold off all questions until then. Q&A will be conducted via the webinar chat box. Feel free to enter in any questions you have via the chat box throughout the webinar, and we'll discuss and address the questions at the end of the presentation. So with that, and to ensure we have enough time at the end of the webinar to take your questions, we'll go ahead and get started. I will now pass it to Monica from the U.S. EPA Office of Research and Development, Strategic Communication and Stakeholder Outreach. Monica will be introducing our speakers today and moderating the webinar. Thank you, Monica, for joining us, and I'll turn it over to you.
Thank you, Christine, for the overview and the introduction and for hosting today's webinar. And thank you to all on the line for bearing with us through some technical difficulties. As with webinars, we had some. We're lucky to have 3 distinguished presenters today. Our first presenter is Dr. Wayne Cassio. He is our Acting Director for EPA's National Health and Environmental Effects Research Lab. He is also a board-certified cardiologist. His presentation is going to introduce you to health effects of air pollution, talk a little bit about the magnitude of health burden in at-risk populations, and highlight our knowledge gaps and describe opportunities for clinical trials that we have to fill those gaps. Following Dr. Cassio's presentation, Susan Stone is going to provide an overview of EPA's and other Air Now products, as well as other informational tools that we have to educate the healthcare system regarding air quality and its use by individuals to modify behaviors to lower exposures. Susan is a senior environmental health scientist from EPA's Office of Air Quality Planning and Standards. The concluding presentation is going to be Dr. Janet Wright. She is an executive director for CDC's Million Hearts Initiative, and she is also a board-certified cardiologist. So with that, I'm going to turn the floor over to Dr. Cassio to get us started.
Thank you, Monica, for the kind introduction, and it's a great pleasure to lead off our webinar with a discussion of the relationship between air pollution and cardiovascular health. There we go. So in a recent summary of the global burden of disease published in the Journal of Lancet last year, ambient air particle pollution was ranked the 5th most important factor associated with global mortality in 2015. Exposure to airborne particulate matter is estimated to cause over 4 million deaths. That's between 7 and 8% of the total global deaths, and 103 million disability-adjusted life years. And that's 59% of these occurring in Eastern and South Asia. Also, deaths attributed to ambient air particle pollution are increasing going from 3.5 million in 1990 to 4.2 million in 2015. Also, exposure to ozone caused an additional 254,000 deaths and a loss of 4.1 million disability-adjusted life years from chronic obstructive pulmonary disease. So, as shown in this slide, despite the tremendous improvement in air quality in the U.S., air pollution remains a significant public health concern. Together, air particle pollution and ozone in the U.S. are estimated to cause 125,000 deaths per year, over 20 million lost school and work days, and over 1 million lost life years. Today in the U.S., nearly 122 million people live in counties with one or more pollutant that exceeds the national ambient air quality standard. Slide 4 shows a good news story. Here, we see two maps of the U.S. showing the fraction of the total all-cause deaths attributable to particulate matter in the U.S. counties in the years 1980 on the top compared to 2010 on the bottom of the screen. What we see is that the result of implementation of local, state, and federal air quality measures, PM2.5 levels have decreased substantially, and the reduction in air pollution has translated into real and enduring improvements in mortality. In the upper map, counties marked in orange and red had the highest mortalities attributable to particulate matter. In 2010, in the lower map, we see dramatic improvements, particularly in California, Virginia, New Jersey, and Georgia. In this slide, the point is to emphasize in the map of the U.S. To show the interval improvement between 1980 and 2010. Based on this improvement, a hypothetical population living with our current particulate matter levels will live about a year longer when compared to 1980, and such a benefit translates into 4.4 million life years for the American public. So, what is this ambient air particle pollution? The illustration on the left shows the relative size of air particles when compared to a human hair and beach sand. Air particle pollution, or particulate matter, is classified based on its size, or its aerodynamic diameter. Particulate matter less than 10 microns in diameter is called PM10, and less than 2.5 microns in diameter is called PM2.5. Federal ambient air pollution standards exist for both of these fractions. Airborne particulates originate from many sources. Some natural, for example, wildland fires, volcanic activity, and dust. Others are man-made. We see these from cars and power plants and industry. As shown on the right side, the composition of particulate matter is really a mixture of materials such as elemental carbon, organic carbons, metals, sulfates, and nitrates, and other compounds. The scanning electron micrograph of a particle is shown as well, and you can see that it's really an amalgam of a number of smaller particles. This small size allows for these to penetrate deeply into the lungs. There, the particles can initiate an inflammatory response and affect the autonomic balance of the nervous system, resulting in blood pressure changes and increases in the likelihood of forming blood clots, heart attacks, or heart rhythm disturbances. Now, in this slide, we see daily changes in particulate levels over several months as recorded in Chapel Hill, North Carolina. What I hope you take away from this figure is that transient increases in daily PM levels, as indicated by the blue arrows, are associated with short-term clinical events such as heart attacks and strokes, whereas the overall average level of particulate matter shown in by the yellow line is associated with long-term clinical events. With this in mind, you can readily see that working to meet the National Ambient Air Quality Standard will reduce both short-term and long-term clinical cardiovascular events. Meeting the 24-hour standard will reduce the triggering of heart attacks, strokes, and worsening of heart failure or arrhythmias, and achieving the annual standard will slow the progression of heart and blood vessel disease and premature death. So, what do we know with certainty when it comes to air pollution and population health? We know that air pollution contributes a high attributable health burden. We know that vulnerable subpopulations are at higher risk. We also know that there is no established threshold level for safe, long-term exposure to PM2.5. We now know some of the basic biological mechanisms that account for these adverse health effects. And knowledge of these mechanisms is giving us insight into how we might mitigate the effects apart from regulatory efforts to improve overall air quality. We also know that the work each state has done to improve air quality has been associated with improved health outcomes, including cardiovascular outcomes, resulting in longer and better lives. Now, in this slide, you see a list of common clinical conditions experienced by people in the U.S. Together, these conditions cost the American public over $500 billion a year. Something that they all share in common is that air pollution exposure is a risk factor for each. So who is the most vulnerable? This slide highlights the populations who are at highest risk from ambient air particle pollution. Hundreds of epidemiologic studies have identified the populations who are at greatest risk. Susceptible adult populations include people with pre-existing cardiovascular and respiratory disease, older adults, and those with low socioeconomic status. Populations suspected to be at greatest risk include those with chronic inflammatory processes which accompany diabetes and obesity. Exposure to ambient particulate matter increases the likelihood of having heart disease. Two recent and independent studies, one from North Carolina and the other from Ohio, show that as much as a 1 microgram per cubic meter increase in the annual PM2.5 concentration is associated with an 11 to 17% increase in risk of having significant coronary artery disease or coronary blockages. And one of those studies was done by our own group here in Chapel Hill. Now, this next slide shows a summary of a number of epidemiologic studies that serve as an important observation that you will better appreciate when Susan Stone and Janet Wright speak. The overall observation is that individuals who have already had a clinical event, that is, had a heart attack or had a stroke in the past, or that are at a much higher risk from air pollution exposure than the general population, and that this risk is as much as 50 times higher than the general population. So, air pollution adversely affects health, longevity, it increases healthcare resource utilization, and it has public health welfare effects, such as effects on visibility and the health of vegetation and ecosystems. Yet while most healthcare professionals and patients at risk have some appreciation for the effect of air pollution on health, very few take action to avoid air pollution, and few healthcare professionals discuss the risks with their patients. Consequently, at-risk patients really don't take action to reduce their exposures. This slide introduces the Healthy Heart Program. As I've mentioned before, an epidemic of chronic disease and aging population is transforming healthcare and putting enormous economic strains on the individual and families and communities, that $500 billion a year price tag I mentioned. Of all the chronic diseases, cardiovascular disease imposes the greatest burden, and we know there's a link between air pollution and exposure and heart disease. The Healthy Heart Program, supported by the Office of Research and Development at the EPA and the Office of Air and Radiation, was developed as an environmental health literacy program. We believe that this program offers an exceptional opportunity to understand how to learn better and to educate the public, heart patients, and healthcare professionals about environmental health issues. Illustrated on this slide are a number of websites and health educational materials that are being made available by the EPA and the Million Hearts program to educate healthcare professionals, patients, and their families. Susan Stone, who was introduced by Monica Lindenbrink, will follow my talk and present an overview of these products and tools. So I wish to thank everyone for their attention. It's been a real pleasure to have an opportunity to share this information with you. Monica, back to you.
Thank you, Wayne, and thank you for the introduction to our next presenter as well. Susan Stone from EPA's Office of Air Quality Planning and Standards is here in the room with me, and so I will turn it over to you. Susan, just as a reminder, just let me know when you'd like for me to advance.
Yeah, go ahead. Thank you very much. It's a pleasure to be here in such a esteemed company and with the people who actually deal with the public and make all these interventions work. And so I'd like to talk to you now about the Air Quality Index and the AirNow website and the tools we have for health professionals. Okay, so this is the Air Quality Index and our generic health messages. And I just want to point out that what this index shows is that as air quality goes from good to hazardous, more people are affected and the health effects are more serious. So the level of the National Ambient Air Quality Standard is between moderate and unhealthy for sensitive groups. We know that below the level of the standard, some people are affected. EPI studies show that people are affected down to fairly low levels, and it's not real clear who those people are, but above the standard, we've done a rigorous assessment. The first groups that are affected are the at-risk populations, or sensitive groups as we call them, with the AQI, and Wayne has already identified these groups for particle pollution. By the way, particle pollution is the name that we developed through focus group testing. We were going to go with particles since we knew most people wouldn't identify with PM 2.5, and then the focus groups told us, well, that could be pollen, so if you call it particle pollution, we will know what it is. So that's why we use that term. So the Air Quality Index is set to identify the question, will I be affected? We've done a lot of focus group testing, and that's the number one question people want to know. Will I be affected? Will my child be affected? Will my parents be affected? It's based on the health information supporting the National Ambient Air Quality Standards. These include controlled human exposure studies, epidemiological studies, and exposure and risk assessments. The EPI studies are used for identifying risk factors, at-risk populations, and the more serious effects. Controlled human exposure studies are useful for identifying the proportion of healthy people affected, the symptoms that they're likely to experience, the mechanisms of the effects, and also that's where we learn about how genetic variability affects a person's likelihood of having health outcomes. And so the basis for all of our AQI advisories is reducing the dose of inhaled pollution. So the dose, as we estimate it from controlled human exposure studies, is approximately equal to the concentration you're exposed to in either parts per million or micrograms per cubic meter, the ventilation rate in liters per minute times the time in minutes. So you can reduce the concentration by being active outdoors when air quality is better, or you can reduce your ventilation rate by taking it easier. Go for a walk instead of a run. And obviously, if you still want to run, go for a shorter run. All of these things will reduce your dose. And we know from controlled human exposure studies that people respond differently. So one piece of advice we always give to people is pay attention to symptoms. One of the main tools that we have for educating health professionals is our web course, Particle Pollution and Your Patient's Health. This is a web course we designed for health professionals. It has sections on what is particle pollution exposure, what modifies that, the cardiovascular and respiratory effects, patient exposure and the air quality index, high particle pollution episodes, such as you might see with smoke, clinical scenarios, and frequent questions. And so we think that this is an excellent tool to help educate your healthcare providers. And you can see the link here. It offers, it offers continuing medical education through the Centers for Disease Control and Prevention. So what is it? Who is it for? As I mentioned, it describes the biological mechanisms responsible for the effects. It helps patients, healthcare providers, advise their patients. There are tools in there. It also has clinical scenarios which give real-world examples that healthcare professionals can use to advise their patients. It's designed for all kinds of health professionals: family medicine, internists, pediatricians, nurses, health educators, and it offers different types of education credits to these different types of professionals. Go ahead. So why did we develop this course? The information that I have here is from a BRFSS survey that was done in 2005, but actually I use this because everybody's aware of BRFSS, but these results are entirely consistent with all the surveys that have been conducted. What we've learned is that people are much more likely to take action to reduce their exposure and to understand what an exposure is if they are told by a health professional. And almost universally, people report that they aren't likely to be told by a health professional. The studies that I've seen, it's somewhere around 20% or less, and that number hasn't budged in a long time. So we're hoping that this course will be used to educate health professionals, but also will be used as a resource. Many health professionals have laptops in their office, and they can send their clients or patients to this resource. Our Office of Research and Development has developed these wonderful outreach materials. So if you want to promote this course, these are on our AirNow website. You can see the link here. Please download them, send them, promote the course using these tools. We also have a web course about ozone. This web course was certified by the American Academy of Family Physicians. We just recently lost that certification. We are going to be updating the course, so right now it does not offer continuing education credits, but you can see the topics on the left-hand bar. It's a very good course. So if you live in an area where there are high ozone levels, I recommend this course to you. Now, on our website with the PM course, we also have these downloadable fact sheets. Most of our information at EPA is directed toward pollutants. If you want to know about ozone or particulate matter, you would go to some of our materials. These are directed at people with particular diseases, chronic diseases. And so these are in black and white, they're front and back, they're modeled after CDC's vaccine information statements. And what we want to have people, health professionals, do is just print one off in their office if people have questions about how air pollution can affect their disease. We have co-branders, CDC for the asthma fact sheet, and the American College of Cardiology and the American Heart Association for the heart disease, stroke, and outdoor air pollution fact sheet. These are also available in Spanish. So we have a medical poster. It's colorful. One of the most effective tools in continuing medical education, a meta-analysis in JAMA found, was there were three things. If you had it in an interactive setting, if you had an iterative process, but also if you had something in a practice that people could refer to, then healthcare professionals were much more likely to remember and use information. And that's why we developed this medical poster. One of the most common forms of PM exposure is due to wildfire smoke. So on the Air Now website, we have this guide, Wildfire Smoke, a guide for public health officials. It was updated in 2016. The previous update had been 2008. So the information is based on the latest evidence base. But we knew when we updated it in 2016 that there were bells and whistles that we wanted to add. So we are in the process of doing that now. And this is EPA, CDC, NIOSH, the Forest Service, California Office of Environmental Health Hazard Assessment, Department of Public Health, and Air Resources Board. So we have developed 6 fact sheets. They are currently in production. I'm hoping they will be out soon, but production always takes a little bit longer than you expect it to. You can read the topics that these fact sheets address. They're in black and white. They're downloadable. They'll be on the Air Now website with the wildfire guide. And during Air Quality Awareness Week, the first week in May, we will be promoting Prepare for Fire Season. And we are also working on the next revision of the wildfire guide. It'll have a very different look. It'll have an updated health section that talks about multi-day exposures and also heat. We're adding sections on the PM web course. Handheld sensors are becoming a big topic. We're adding something about that, and also ash cleanup, and you can see the additional fact sheets that we will be creating. And lastly, I just want to show you, if you've been to the Air Now website, the version on the left is what it looks like now. It opens up with a national map of current conditions. We are in the process of completely updating the website. All of the same information will be there. We're making it mobile friendly, so it's going to look like the website on the right. And what it will do is it will take folks to current conditions where they are, because we know from Google Analytics that that's what people are interested in. And there will be, it will tell you the pollutant, so you can see, I think it's PM 2.5 on the dial. This way people will know what conditions are, and they will also know the forecast. And if you look at the bottom, you can see the bar chart where they can tell the trends in PM, and hopefully that will give them an indication of when it's the best time to go outdoors if they have flexibility to exercise. We're really trying to promote exercise along with cautioning people about air quality. And that's it. Thank you.
Thank you, Susan. Our last presenter for today is Dr. Janet Wright. She's Executive Director for A Million Hearts. Janet, I'm going to turn it over to you. Please just let me know when you'd like me to advance your slide.
Thank you so much, Monica. And also want to thank you, Christine, for the opportunity to join this panel and also to get connected to the environmental health professionals across the country. And I have to tell you, Susan, I almost, while I was listening to you, I was so absorbed in what you were sharing that I frankly forgot that I was one of the presenters. It was just enjoying the content. So, and I always learn so much from you, Wayne. So again, I'm very appreciative of joining this panel. My job today is to show you how an initiative that is focused on improving cardiovascular health across the country and preventing cardiovascular disease is is where we found a role that we might play in regarding particle pollution. So I'll give you some background on Million Hearts, and then I will show you what it is that we are doing and how interwoven we hope to be even more deeply with this work going on at EPA. So Million Hearts 2022, this is our second 5 years. We are in the second 5 years of a national effort, public and private, to prevent 1 million events, heart attack, stroke, even making headway in kidney disease, and even dementia through better blood pressure control over a 5-year period. We launched this phase, the second phase, in January of last year, 2017, and will persist in the effort until December 31st of 2021. The initiative is co-led by CDC and CMS, and the concept there is to bring the experts in public health with the scientific credibility and the community roots together with the payment and policy heft that exists at CMS, but to help focus work that is going on around the country and to really align around a common goal. We have partners in almost all the federal agencies within the Department of Health and Human Services, as well as the EPA and the VA and USDA, and have a presence in each of the states and many private sector organizations. On the next slide, you'll see the framework that we've adopted for this 5-year phase. Actually, this slide will start here. Sorry, I forgot this one. Some people would call this a disease burden slide. I would say in Million Hearts we call it an opportunity slide. Just a way to look at the numbers of people who could be touched by an effort to prevent heart attack and stroke. We know that 34 million people have uncontrolled hypertension, and as we all adjust to a new set of national guidelines, that number has increased dramatically, the number of uncontrolled. With cholesterol, we know that 35 million people who qualify for medication treatment are not taking medication, and 42 million who qualify for a lifestyle treatment for their lipid problem are not practicing those healthy habits. With sodium, 90% of us overconsume. With physical activity, about half of us are underexerting. And then, of course, there's still a large number of smokers in the country. But I'll go back to the number that Wayne used. And Wayne, I don't know if it was only adults that you calculated there, the 122.5 million people in counties where the air particle pollution is not at desirable levels. But if it is adults, we know that children are also at high risk. The thing about Million Hearts is that in contrast to what you've heard today already about the lack of awareness both in the healthcare professionals and in the general public about the impact of particle pollution, when it comes to cardiovascular disease, there is a very high awareness of the connection between the things on this slide and the likelihood of having heart disease and stroke. So our efforts in Million Hearts are not really directed at raising awareness of something that's pretty high. Our job is to try to fuel implementation of what works so that the things that work are reaching everyone everywhere. We know that penetration of those interventions and strategies that are very effective have not been systematic or methodical across the country, and chunks of the population, whether it's those in rural communities or those of a race or ethnicity or an age group or gender. It's not happening for everybody everywhere. And it's this desire to drive implementation that is really at the heart of Million Hearts. So on the next slide, I think you will see the framework that we are using. We're using a tripod that is up in the left corner. You see Keeping People Healthy. That's the code name for our public health or community-based actions. Over on the right side, Optimizing Care are a small set of healthcare system-based actions. And then the third leg of the stool is a focus on priority populations, and I'll provide a little bit more detail on that in a moment. As I mentioned, we did have a first 5 years. We probably will not reach 1 million prevented events over that 5-year period. We'll have final data on those numbers in 2019. And our current predictions are that we will have prevented, this collective effort will have prevented about 500,000 events over the 5-year period. Not 1 million, but certainly not insignificant. We are starting at 0 as of January of 2017 and making another run at 1 million because of the huge number of places around the country and organizations like EPA and others who've put their shoulders to the wheel. So on the next slide, we'll go into just a little bit more detail. We'll look first at those 3 categories again. Upper left corner, keeping people healthy. Again, these are population level or community-based efforts. I think the reasons we chose these, in fact, I should say that all of the things we chose came from either the modeling that we did. We modeled with 3 separate independent modelers to come up with the actions and interventions that could have the greatest impact on outcomes in a 5-year period. Clearly, those things on the left qualify. Over on the right side, those are the healthcare actions. We are sticking with improvements in aspirin, blood pressure, cholesterol, and smoking, the ABCS, because of the huge number of events that are prevented when those factors, performance on those measures are high. We've added an aim to increase participation in cardiac rehabilitation. And I'll come back to that in a moment about how that aligns with the effort to raise awareness about particle pollution. And then engaging people in heart-healthy behaviors, getting a start in the clinical setting. Again, priority population chosen first, as you see.
I'm sorry to interrupt. Dana, I'm sorry to interrupt. This is Monica. You're a bit garbled. It suddenly happened. I'm not sure why.
Uh-oh. Monica, is that any better?
Yes, that's better.
Okay. And how about that?
That's good as well.
Okay. Thank you for letting me know, and please let me know if I re-garble. Priority populations here, we chose them based on disparate outcomes. They're effective in different outcome, and that we have partnerships particularly well positioned.
Sorry, Janet, you're garbling. You're garbling again.
Okay. Any better?
It seems to be better when you ask and then for some reason you get started, it garbles again, but that did sound better.
Okay. How's that?
That's good.
Okay, Monica, let's go to the next slide. I just want you to see that there are strategies, again, taken from the literature, from experts, and from experience in communities around the country in terms of what works to achieve the goals of reducing sodium and tobacco and increasing physical activity. On the next slide, you will see the optimizing care strategies, those to be deployed in healthcare settings. And I've highlighted those that are particularly relevant to particle pollution. We know that individuals who've had a heart attack or a cardiac diagnosis or stroke are at higher risk for particle pollution, and knowing that cardiac rehab professionals meet with these high-risk individuals lets us know that it's a perfect venue for the education and knowledge building that we know needs to take place. Likewise, that engaging patients and families in their care, this is another great opportunity to propagate the information and the knowledge about how to mitigate exposure and mitigate risk from particle pollution. On the next slide, we look at the priority populations, and again, I tried to highlight places where we're particularly excited about being a conduit for the information that you've heard about today. Making sure that in cardiac rehab programs and in counseling of people who have had an event that we are incorporating knowledge about particle pollution exposure and really increasing the use of the air quality index and the other tools that Susan described. On that next slide, thank you. I just wanted to let you know the team at CDC has a paper in press that looks at the level of awareness about air quality and its impact on heart disease. I can't break the embargo and let you know the results. I'll just suffice to say there is lots of room for improvement in terms of awareness and consumers as well as mentioned earlier in health. On the next slide, I want to begin to show you some of the things that we will be doing through the avenues that we have in Million Hearts. This picture you've seen. We learned about this wonderful snapshot from EPA and now have it on our website. We have a website, in fact a whole web page devoted to particle pollution, and we will continue to keep that updated with new publications, and hopefully it can serve as an additional source of information for people who might be shopping for that on our website. On the next slide, we've begun to crystallize around a couple of things. One, of course, is, as I mentioned, driving people to the air quality index and helping them understand how to use it. I will say, and I'm not ashamed of this, I spent part of my Saturday night taking the wonderful Particle Pollution and Your Patient's Health course. I recommend it to everyone. It is very well done. I really enjoyed it, and I learned a lot. And so we will, many people on our team take that now, and we'll back to it to the extent possible for us. On the next slide, we have begun to crystallize around the key actions. Trying to get this as simple as possible, and yet always link to materials where people can find more information. I think Susan and Wayne went over these action steps, but what we learned in our work is that because we are pushing cardiovascular health and reduction in cardiovascular disease with no other motive in mind, we have become trusted as a source of information, and what people really are hungry for are the bullet points, the exact things that they should or shouldn't do. So these messages are, again, on our website, in our materials, and will be in our presentations too as we go forward. On the next slide, we try to distill it even further. And I'd say these are the things that our family, Million Hearts family, our partners have all committed to over the remainder of Million Hearts 2022. I put the clinician outreach in bold because, as I think Wayne said, there's a particular lack of knowledge among the clinical community about who is at high risk and how those high-risk patients might mitigate their exposure. So I'd say for whatever division of emphasis we'll make, we're going to really weigh towards the clinical community. And as I mentioned, getting this information more deeply embedded into cardiac rehab curricula. I think next slide. And for more information about Million Hearts, I've put the website there and my own address. Please reach out to me if I can answer any questions, or if you have some suggestions and advice for us at Million Hearts. Thank you. I'll turn it back over to you.
Thank you, Janet. That concludes our presentations for today's webinar. I want to thank Wayne, Susan, and Janet. Excellent presentations. We do have a number of questions on the webinar, so I'm going to go to those questions. I will read those and then try to parcel them out to the right person. If you're not the right person, you're not going to hurt my feelings. Just call on someone else to answer that question. So the first question is from Juliana. She asked, how exactly do you determine a death was due to ozone exposure or ambient particulate? And then a follow-up to that, are there specific diseases that are only caused by those factors? And I will ask Wayne to answer that.
Yeah, thanks, Monica, and thanks for the question. It's an excellent one because there's no death certificate that's going to have written on it, death was due to air pollution. These are estimates of deaths which are attributed to air pollution based on what we know from epidemiologic studies in populations which show an increased odds ratio of mortality or hazard ratios. So these are estimates based on fairly robust and data and analysis that's been done over many years.
Thank you. I hope that answered your question, Juliana. Then the next question is from Kate Perry. Her question is, what policy changes between 1980 and 2010 contributed to the decrease in deaths due to PM 2.5? And I'm going to ask Susan to answer that question.
Thanks, Monica. Since 1980, we actually developed a national ambient air quality standard for PM 2.5 in 1997. So that's one of the controls, and we have updated that periodically since 1997. There have also been mobile source rules that have reduced particle levels, and then stationary source rules, such as rules for electric utilities and all different types of industries, which are industry-specific, that have reduced particle levels around those facilities.
Anyone else want to add to that, Wayne or Janet?
I think Susan's answer covered it.
Yep.
Thank you. The next question is from Ms. Baldassari. I apologize if I butchered your last name. The question is, what kind of information exists on dangerous indoor PM 2.5 levels? I've been displaced from my home and am diagnosed with environmental lung disease due to long-term exposures in my small New York City apartment. A respected certified professional IAQ hygienist concluded via PM 2.5 levels that my apartment is uninhabitable and a health risk. Is there any data I can use from the EPA or other agencies that is relevant? Wayne, would you mind answering that question, please?
Well, I'll do what I can. Although the EPA doesn't actually have any regulatory authority on indoor air. So, and I think Susan will probably comment on this too. But it's very clear that indoor sources combining with outdoor sources can have significant health impacts. These are particularly well known globally because of indoor cook stoves, which produce a massive amount of indoor smoke and are with attributable lung and heart disease. So I appreciate the gentleman's question, and I can understand how it has potential danger. But as far as what kind of information might be available to them provided by the EPA, I don't know. Susan, do you have anything to add to that?
Yeah, I would say that I think we have a pretty good idea from epidemiological studies that indoor PM, obviously, we know PM from outside gets indoors, and in the epi studies track daily exposures, and we know most people don't spend their time outdoors, and so we can infer that some of these effects are caused by indoor particles as well. We certainly know that during smoke events, indoor particles can be a serious concern, and that there's a well-established literature that indoor air filtration devices, HEPA filters, and reducing other sources of particles can help. We have an Office of Indoor Air Quality, and so you could check there for specific levels and any particular hazards. But if you've had an industrial hygienist come in, certainly they can give you information about specific indoor levels.
Thank you, Susan. Thank you, Wayne. The next question is from Kate Perry. Could the repeal of the Clean Power Plan contribute to an increase of deaths related to PM 2.5?
I'll jump in on that. Since the Clean Power Plan hasn't been repealed, and we expect that it could be upheld in the courts, I think the question is a little premature, but obviously mortality is related to PM exposure.
Thank you, Susan. The next question is, what are the kinds of actions healthcare professionals can recommend to patients to take? And I think those were covered in the presentation, but I think if anybody would like to elaborate on the specific actions, Wayne, would you like to summarize those?
Yeah, I think the first is that healthcare professionals should do everything they can to emphasize the actions that actually Dr. Wright advocates, because I think if we can decrease the evidence-based risk factors for heart disease, we will be way ahead in terms of preventing any kind of environmental impacts. So that's number one. So once we've taken care of that, we want individuals who are at risk, and I elaborated on those, older individuals, those with heart disease and lung disease being the main ones. We're not concerned about young people having heart attacks and strokes, but we are concerned about long-term exposures to young people having some impact on the growth of their lungs or the development of asthma or other lung disease as they get older. So we want people to be aware of their outdoor air quality. Susan spoke about the Air Quality Index and how that is a very useful and readily available tool. And then to use the guidance provided by the Air Quality Index to make decisions about when is a good time to exercise outdoors, and also where to exercise outdoors, to choose areas that are lower in air pollution. If one has the opportunity to go to a park as opposed to walking on a city street or near a highway or a large industrial area. So these are some of the things that we would advise. And then for special events such as wildfires, where smoke is an issue, we have some additional recommendations, which might include staying indoors, using a HEPA filter to produce a room with clean air, and if really air quality is poor, to use an N95 respirator, which are available at hardware stores and sometimes at pharmacies and drugstores to when outside to reduce the exposure to air particle pollution. Susan, you want to add anything?
Oh, I think you've covered it. Thank you.
Well, we're coming up on the hour, so I'd like to thank our speakers again and thank you all for taking the time to join us. We hope you found value in the webinar today, and please be sure to fill out our webinar survey afterwards. All materials in the webinar will be posted in 1 week, and they would also be emailed to those who participated today. Again, thank you so much, and have a great day.
Thank you, Christine.
Thanks, everybody.
Thank you.
Thank you so much.